Hi, I'm Dr. Keri Topouzian, and you're watching Ask Dr. T. Today's question is, I'm losing my hair, how can I grow it back? Well, you don't have to have a green thumb to grow your hair back, just need an anti-aging physician who uses a local compounding pharmacy to formulate a solution for you. Now, for those of you who don't know what a compounding pharmacy is, they're like the old style apothecaries where they can make anything up from scratch depending on the formulation that a particular physician needs. These are all prescription items, and you do need a physician to have these done, but they work out better than just using things that you might pick up over the counter. Now let's talk about some causes for hair loss. Hereditary is only 20%. Which means that the other 80% is potentially treatable. Inflammation is a very common cause of hair loss. Elevated DHT, which is dihydrotestosterone, and this is where a lot of the research is being done right now, and medications are coming out to actually treat this right here. And the way it works, and I've drawn a nice diagram here, where this is testosterone, which makes actually two different hormones. It makes estrogen and it also makes DHT, dihydrotestosterone. But there's an enzyme that runs this reaction, and it's called 5-alpha reductase, okay? And most medications out there, what they're trying to do is they're blocking this enzyme so that you don't make DHT. More on this later. We'll go back here to some other causes. Low thyroid function, very important to get your thyroid checked and not just have a screening test done on it. Stress will also cause you to lose weight. Well, it will make you lose weight, but you'll also lose hair in the meantime. Low protein diet can cause hair loss. Now, you may be getting enough protein in your diet, but if you're taking antacids or the purple pill, Nexium, or Prilosec, one of the medications that are used to decrease acid production, what happens is your body needs acid to actually break down, digest, and absorb protein. So conceivably, you could be on one of those medications and it could be causing you to have hair loss. Hormone imbalances, specifically low DHEA levels, will cause hair loss. Women going through menopause because of the imbalance of their hormones or low hormone levels, they'll have hair loss secondary to that. Oxidative stress or free radical damage, which will actually degenerate the hair follicles. Environmental toxins, this is something we'll also check for because it'll just wreak havoc on all these different causes, making them worse. Excessive vitamin E consumption, and also smoking. Smoking basically decreases the amount of blood flow that gets to your hair follicles. Now, goals for treatment. The main thing that we want to do is we want to seek out and treat the underlying cause. Figure out what's going on and target that, treat that. Also, minimize side effects, increased hair shaft diameter, increase the number of hair follicles, increase the rate of growth, and increase the hair shaft strength. Okay, these are all the goals. Now let's talk about some treatments. Now, we can treat internally, taking different supplements or medications, or we can also treat topically, right on the skin. First, let's talk about treating internally, and these are all some different supplements that can be taken to help with hair loss. The first one up here are omega-3 fatty acids, which are anti-inflammatory. Specifically, some examples are fish oil, cod liver oil, and krill oil. Very important. Turmeric is a spice which is also anti-inflammatory, which will help with hair loss. Vinpocetine comes from the periwinkle plant, and it actually increases blood flow to the hair follicles. So if you can't stop that habit of smoking, you might want to consider taking some vinpocetine. Cysteine is an amino acid that will promote hair growth, and a good source of cysteine is whey protein. If you've got low iron, it's important to correct low iron. L-carnitine is another amino acid that will help stimulate hair growth. And folic acid, which is a B vitamin, will increase the blood flow to your hair follicles as well. Now, remember we were talking about that enzyme, 5-alpha reductase, okay, which converts testosterone to dihydrotestosterone or DHT. Well, the main drug on the market is Proscar, also known as Propecia. And what it does is it will block that enzyme, but it does have some side effects. I've listed 2 of them up here, linked with depression and also irreversible sexual dysfunction. Now, I don't know about you, but this one bothers me a little bit here on the bottom. Okay, irreversible. That means it doesn't come back. I would consider looking at other options maybe before actually taking this medication. And there are other natural 5-alpha reductase, inhibitors, and I've listed a few down here. Saw palmetto, green tea extract, zinc, borage or primrose oil, and also progesterone, which is a natural hormone. Now, as far as topically, there are a couple of 5-alpha reductase inhibitors as well. Progesterone, again, is up here, can be used topically in small amounts. Also something called azelaic acid, which is actually a prescription that's used for acne at present. But these are things that can be formulated at a compounding pharmacy by an anti-aging physician or a physician that specializes in hair growth. There's other topical agents that can be used as well. I'll list a few of them here. ALA is alpha-lipoic acid, which is an antioxidant, Melatonin is a hormone which will actually promote hair growth. Nifedipine is a medication that can be, well, actually what it does is it increases blood flow by causing vasodilation. So the more blood flow to the hair follicles, the better the growth. Coenzyme Q10 is another antioxidant that can be used topically. T3, which is thyroid hormone, in small amounts will also promote, stimulate hair growth. And ketoconazole is a medication on the market that will help with inflammation. And again, the main key is to seek out and treat the underlying cause. That way, if you know what's going on, you can put together a game plan to treat the problem. Any questions out there? There's one right there. Well, you can email me at askdrt@gmail.com, or you can go to our website at www.cfhll.com. My name's Dr. Keri Topouzian, and this has been Ask Dr. T.